Hi, I'm Ed Roth. I'm the Central Region Director of the Massachusetts Shine Program.
And my name is Kerry Faria. I'm the Assistant Director of the Central Massachusetts Shine Program.
And Kerry, we're fortunate to get into everybody's homes for our program, and I was just reflecting, and today, right around now, is the first anniversary of the first program we did for folks, and we've done some really good shows, and I hope we've brought some informative program into folks' homes, stuff that will help them. Do you want to talk a little bit about what some of the programs we've done?
Sure, I'd be happy to. Some of the issues we've addressed and some of the subjects we've actually talked about would be things like Medicare enrollment, which we're coming up to again pretty soon, and we're going to talk a little bit about today. We've also talked about Prescription Advantage. It's a wonderful state program that helps people pay for their medications at certain points throughout the year. We've also talked about other state benefits that people could possibly qualify for. We've talked about Medigaps, or what are called Medicare supplemental plans, and also what are also called Medicare Advantage plans, or Medicare C. We've talked about that. We've talked about community legal aid. We've actually had some guest speakers come in, one of which was from community legal aid. So we've had a variety of topics that we've really touched on throughout the year, and we've come full circle. So it's our first year anniversary.
We have come full circle, and a lot of those programs that Kerry just mentioned are available to you folks on our website. And our website is www.shinema.org. You can go on that website, and on that opening page, we have a Medicare and More link, and you can click to all our programs. So if you or a caregiver comes in and has some questions, you can refer right back to those programs. Today, we're looking at beginning this whole thing kind of all over again a little bit. Medicare Open Enrollment will be coming up soon, and we want to review a little bit about Shine, okay? Now, the Shine program is offered by the Executive Office of Elder Affairs in the Commonwealth of Massachusetts. We have 600 trained Shine professional certified counselors. They're all volunteers located in senior centers throughout the Commonwealth. Here in Massachusetts, Kerry, I think we have pretty good coverage. Can you talk a little bit about that?
We do have very good coverage, and that's been one of our goals, is to make sure that our region gets covered well. So we have about 63 cities and towns in our area, in our central Massachusetts area, and we've got about 53 volunteers spread out throughout this territory as well. So we have just about 90% coverage in our area, which we're really, really proud about. Because it takes some effort. There's some areas that are a little farther out, a little more rural, so sometimes it's hard to find a volunteer that's willing to take the time out in those areas. But we've managed, so we're doing really good. If you don't have a volunteer in your area, I bet you have one very close to you. So again, if you need the services of Shine Counselor, you can certainly call us at the central office. We'll put our phone number up and our contact information up on the television screen for you. And give us a call, and we'll tell you where the nearest Shine Counselor is located. So we try very hard to make sure you're getting the service from the program that you should.
And you can always call us at the regional office, and we can certainly try to help you with that. And as Kerry said, we'll refer you to a senior center near you that can help you with can help you. We want to get you in to talk one-on-one if we can, and you can bring your stuff with you, bring your Medicare card and important information that will help us analyze the situation you may be going through. And right now, Medicare Open Enrollment is coming up, and Medicare, each and every year they have an open enrollment period, something similar to what you may have experienced when you're in a corporate sector or when you're in your working career. And every year from October 15th through December 7th, you have an opportunity to change your Medicare insurance and change the plan or plans that you're currently on to something that may fit your needs. Fortunately or unfortunately, the case may be, and we had the same thing when we were working, a lot of these plans change each and every year. They change their coverage, they may change their provider list, and they certainly may change their drug formulary. So it's good to review your situation every year and go over this. So what we have is the open enrollment period from October 15th through December 7th. That's the period of time you can change your plans, and you're changing your plans for a plan that will be effective on January 1st. So, but you got to remember, after December 7th, we can't really help you out. It's very difficult for us to help you out. So that's the time period we have to do it. And a little bit more about the open enrollment, Kerry, if you'd care to talk about it.
Sure, I'd be happy to. Open enrollment is very important, and we cannot stress enough that it is super important for people to review your insurance, just as Ed had mentioned earlier, because every year we get calls in our office, like in the beginning of January, where someone says, I went to the pharmacy and I can't get my drugs filled. Did you check your plan during the open enrollment? Lots of times the answer was, oh, I didn't get to it, or I was too late, or I didn't know I had to. So we're really trying to spread the word. Please, please, please use the open enrollment to review your insurance options, make a choice if you're going to make a change, and then the new plan would be effective as of January 1st. Now, if you like your insurance, you checked it out, and it doesn't need to change, looks like it's still going to be a good fit, you don't do anything, okay? And if you don't do anything, your insurance will stay the same as of January 1st. So what can you do during the open enrollment period? Well, that would be the time period that you would want to look at your Medicare Advantage plans. So you're going to get lots of information in the mail, if you're not already, very soon, regarding Medicare Advantage plans, their provider networks, what hospitals they contract with, what drugs they're going to cover, what the tiers of those drugs are going to be, what are your co-pays going to be for the coming year. All of that information is going to be sent to you. This is the time to look at that. So you want to make sure that the doctors that you like are still participating with that insurance plan. You still want to make sure your drugs are covered, and you know how much they're going to cost for the coming year in 2016. Because again, if you don't, and it's beyond December 7th, as Ed said, you're kind of stuck. You're going to be committed to that plan for all of 2016. And just because you didn't check your insurance doesn't mean Medicare is going to let you make a change in January. So you do want to review your Medicare Advantage plans. Again, all the information I already spoke about. It's also the time period of which you want to check out your Medicare prescription drug plans. Same sort of theory applies. You want to make sure that the plan that you're in is still going to be effective for 2016. So you still want to make sure that that particular drug plan is still going to contract with the pharmacy that you like. You want to make sure your drugs are still on their formulary. You want to make sure you know what the tierings are going to be and the cost is going to be, because the plans have a lot of flexibility. They can change every year in any sort of way they want to. They can change their formulary, they can change their co-pays, they can change almost everything they want to and make themselves and reinvent themselves into something new. So please, 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 it's our mantra every year, please check your insurance during the open enrollment period. Make sure you like it and you're all settled with it. Make a decision and do the enrollment, and then the new plan would begin in January. Again, if you like your insurance, and you checked it all out and it looks like it's going to stay stable and you like how it's going to work, you don't need to do anything. It'll just roll over into the new year.
Yes, and we want to make it clear that your Medicare health plan, your Fallon, Tufts, or Blue Cross Blue Shield PPO, they're your health plans, the HMOs and the PPOs. Now your Part D plans or your Medicare drug plans, they're usually associated with folks that have a Medicare supplement plan, like a Blue Cross Bronze or a Harvard Pilgrim supplement plan or a Fallon supplement plan. These are kind of high-end plans, and they don't have drug coverage associated with them. So you pick up a Medicare Part D plan. And as we're trying to emphasize today, is these Part D plans change every year. Every year they change, and they maybe cover your drugs. They may still cover your drugs the same way they did last year for 2015. But in 2016, a lot of plans may take a drug off their formulary. They're not going to cover it anymore. Or they put it in different tiers. We all see the situation where a lot of these medications now are in tiers. Tiers 1, 2, 3, 4, and 5. They have another tier called specialty drugs, okay, that become very expensive. So if your medication goes from a tier 2 to a tier 4, you're going to be paying more money for that medication. And it could possibly be a plan in the system that still has that medication in a tier 1 or a tier 2. So it's a good, if you read your drug plan, you see a medication that's changing tiers, you may want to give Shine a call. We can send you one of our pre-enrollment drug search tools, and we can check your plan for you. You know, we can see, we can go to the Medicare.gov website and search the site to see if there's a plan that may better meet your needs. So that's what we'll be doing come open enrollment. But again, you got to take a look at the stuff. Don't we urge you? You know, you're going to get this stuff in the mail, and there's, by goodness, there's an awful lot of it, and it's overwhelming sometimes. And you're going to get it in the mail. You're going to get a letter from Social Security about your Part B, and you're going to get this, that, and the everything, and it gets overwhelming. And I know folks tend sometimes to put it in a pile, but this is important stuff. It really can affect you financially, so it's good for you to open it up, look at it, and if you've got any concerns at all about a medication that's changing tiers or something like that, or with your Medicare Advantage plan, if you have a situation where maybe the insurance provider you have now, Fallon, Tufts, or whoever, is not going to cover your provider. We had that happen a couple of years ago when Fallon changed, and they weren't the Reliant folks. Reliant Healthcare was no longer in the Fallon system, and we had to see a lot of folks change from Fallon to Tufts. So we hope there won't be anything like that this year, because it's very complicated for us and it's a lot of work. But it's not what it is for you folks that might have to jump through a lot of hoops to change your doctor. So again, we encourage folks continually to read this important information, and if they have any questions at all, to get a hold of us. And the mailings, I think, start in September. Is that right, Kerry?
Yes, a lot of the insurance mailings start in September. And so again, this is the time of year where you're going to get a lot of stuff in the mail. So the plan that you currently have, though, is also going to be sending you information in the mail. So the current plan that you have is going to be telling you what your coverage is going to be for 2016. So that's the kind of things you need to be taking a look at. So please do not throw that away. It's important information you actually take a look at. So open up those packets, look at the mailings, look at the information that's within those, because again, it's going to tell you what the benefits are and what the plans are offering for 2016. Again, if a lot of it doesn't make sense to you, you can certainly give us a call and we can tell you what the plan changes are going to be for the coming year. We have not received that information yet, though. I do want to stress that we don't get plan change information probably until somewhere after the 1st of October, more towards October 15th. The health plans and the drug plans hold on to that information pretty tightly until close to open enrollment. So we don't even know what that information is until pretty close to October 15th. So you can give us a call, but if you're calling sometime in September, it's going to be too soon. So you should wait to do that. The other thing I want to encourage people is, if you do want to call us, that's fine. But we'd prefer that you call earlier during the enrollment period versus later. The closer you get towards that week in December, the harder it is for us to respond to people, just because we have so many people that we're assisting. So please get to us in the early days. The other thing I just want to also put out there is you could check your information yourself. We go to Medicare.gov, website, www.medicare.gov, and within that website, they have what's called the Plan Finder. And in the Plan Finder, that's where you start going through kind of the motions of determining which is the least expensive drug plan or Medicare Advantage plan for you, by putting your medications into this Plan Finder. So you put your information into the Plan Finder, and literally it'll sort all the plans for you, and it will put them in order from least expensive to most. So if a person is computer savvy, they can do this for themselves. They don't need to give us a call. Medicare is also available to help people find drug plans and Medicare Advantage plans. There are also some other agencies, for example, the Massachusetts College of Health Sciences and Pharmacy can also help somebody figure out a prescription drug plan, especially if somebody's taking really complicated drugs. They're experts at that. They're the experts on that kind of thing. So We can do it, but some other people can also do it. So again, check those notices, don't throw them away, open your mail, read it, see what it says, and it will tell you everything you should know for 2016. But if you get stuck, you have trouble with it, you can certainly give us a call, and we'll certainly help you out with that.
Yeah, Kerry, and thank you for mentioning the Mass College of Pharmacy and Health Sciences, because they are a real key partner of ours. They will work to help you through your Part D program. They also, again, as Kerry mentioned, if you're taking some complicated medications, if you're taking medications that have to be mixed or compounded and stuff like that, they're the folks that can really give you some answers. They're staffed by pharmacists and pharmacy students that really are on top of everything associated with prescriptions and kind of the latest stuff. They also have some resources that if a medication is expensive, they can help you with that too. They can get you into some resources and some programs that may assist you with some of the costs of those medications. So again, an outstanding resource. The number's going to come up on your screen, and you can see the number and how to reach out to them. So again, a great partner of ours, and we're real happy to work with them. Kerry, what else we got going on in this area?
Well, there's always, people think that insurance is boring. Things are always changing in insurance, and actually it's more exciting than you would think. One thing that's come to our attention over the summertime, and it's going to be coming effective pretty soon, is that there's a program called One Care Plans. And One Care Plans are a combination of Medicare benefits, health insurance, and drugs all wrapped into one. And those are plans that are specific to individuals that have mass health. You have to have mass health in order to be able to be in a One Care plan. Well, unfortunately, one of those plans is terminating, and that's called Fallon Total Care. So Fallon Total Care is pulling out of doing business, period. They're not going to offer a One Care plan anymore. So that really is going to affect a lot of people in our area between, let's say, Worcester, Fitchburg, and in our neck of the woods. About 5,000 people are going to be affected by this change. So if you have what's called a Fallon Total Care plan, you want to be seeking some assistance on what to do about it. There is a plan that you can go into. There's another One Care plan a person can move to, and that's called Network Health or Tufts Unify. It's kind of the same animal. They are taking some people from Fallon Total Care, but they won't be taking everybody. The other option somebody could do is they could just, if they do nothing, if they just wait and they don't do anything with their Fallon Total Care, by the end of September, that plan will terminate, and by October 1st, then the person will revert to having original Medicare. They'll have Mass Health Standard, and everybody's going to be put into a drug plan called Humana. So at least you would have coverage. So the only iffy part to that, if you go back to original Medicare and the Mass Health, is the drug plan. The drug plan is obligated to cover people for 30 days. So for all of October, nobody's going to have a problem with their medications. They're just going to be able to go to the pharmacy like any other day, and all of their meds would be covered. But as of November 1st, the Humana plan is now going to stick to their formulary. So now they're going to stick to their list of drugs, and they're not going to just cover everything anymore because they're not obligated to do so. So as a result, some people might have trouble when they go to the pharmacy in November, and they may find that some of their medications are not covered. So we can help people find appropriate drug plan if need be, if they want to have that done. So again, you can call us if you're in a Fallon Total Care plan. This does not affect any other Fallon plan. I want to make sure that's super, super clear. Does not affect Fallon senior plans, doesn't affect the Medigaps, doesn't affect anything with Fallon with retiree plans. This is only one specific insurance plan that's terminating. So again, if you have Fallon Total Care and you should have received a notice already from the state and from the plan saying it's terminating, and you're not sure what to do about it, you can certainly give our office a call, and we'll do our best to guide you on what you could do.
Yes, and these One Care plans, they're targeted specifically for folks from 18 to 64. So they're not targeted at seniors. So and those folks have to have Mass Health and Medicare. And in order to fit into that category, you have to be disabled. So again, the plans are targeted to disabled folks, okay? They're not targeted to the folks we normally see, our senior population, our Medicare population over 65. So again, you would have received a letter from Fallon Total Care. You would have received another letter from Mass Health explaining what your options are. But if you're confused, nervous, perplexed, give us a call. We'll try to talk you through it. I mean, the situation is simple. These plans have a lot of great benefits to them, and unfortunately, those same benefits won't be happening anymore for a lot of these folks that have Fallon Total Care. So again, we want to be able to help you through it and talk you through it, and that's it's an important little glitch. Again, these things happen all the time to us, and we want to make you folks aware, and the folks that are watching us on your local community cable programming. Also, I want to let everybody know that we sent out a notice, so we're a little bit late on it. I sent out a notice last week to your local senior center directors to let them know that we're going to be available to come in and do a Medicare update. Do a Medicare update seminar, Medicare update meeting. So you can come to that meeting. The senior center folks will schedule a meeting, and one of either Kerry, myself, or one of our volunteer counselors will come in and review any of the changes that Medicare is going to have. As Kerry said, we won't see them until at the very earliest, October 1st. They usually come out with them and they release them. Now, to be perfectly honest with you, that they know what they're going to be, but there's a big embargo on them by Medicare until October 1st. So we don't know what they are until then. Then we get the information. We have to hustle to really get the information in terms that folks can understand. We do a PowerPoint presentation for folks, and we'll do we'll make the information as easy to understand as possible when there are changes. So again, that letter went out to the senior centers, that email we sent, we're starting to get returns on it. Senior center directors are sending us, scheduling a meeting, and that schedule will be available, will probably be available on our next program. We're going to do a program in October that will discuss a lot of the changes to Medicare. So we hope to get that program out by October 16th to 17th, and so folks can understand what the changes are. And as always, with all of our programs, they're available on our website. So again, our website, www.shinema.org, is a tool that we're very happy about. It's a tool that, again, folks with our seniors and in particular their caregivers that might not be that familiar with the internet and the website business can take a look at and pick up some important information. We like to keep it as updated as possible. Sue Carden, our director here today, is really our go-to person on that website, so we keep the information as current as possible. And we just want to emphasize again that you're going to be getting all this mail. Keep it. Don't throw it away. And if until after you've used it and thought about it a little bit, because it's important that if you get something that makes our lives a lot easier, if we get an idea of what's going on. And again, if we checked it, and an important thing too, if we did a search for you last year, we probably still have that information, so it might not be as complicated a process as it was when we first did it for you. So again, we're into a silly season, as we call it. It gets busy. We'll talk to probably 2,000 or 3,000 people between now and between October 15th and December 7th. We get a tremendous amount of calls. And if you call, we might not be able to get back to you as quickly as we'd like to. So it could be a couple of 24-hour periods before we get back to you. But a volunteer will get back to you, okay? And try to get the information from you and get enough information so we can help you. The important thing is we want to get as much help to people and clarify their situations for folks. We don't want, that's what we do, okay? We guide you through this very complicated process every year, and that's what our mission is. That's what we do. That's what all our volunteers do. Kerry, any other little tidbits you have for us?
Just again, reemphasize what you were talking about, that in the fall, what we do is we schedule appointments to go out, either Ed or myself or qualified volunteers, to go out and to speak at the local senior centers where you may live close to. And what we'll do is we'll give a presentation on the plans for 2016. So if any of the health plans are making changes or any of the drug plans are making changes, every year a drug plan might drop out of serving this area, or a Medicare Advantage plan like a Tufts Preferred or Blue Cross Blue Shield, PPO Blue, or the AARP plans, they may back out or they may change their provider networks. So what we do is we get that information and then we go out to the senior centers and we give a presentation. So it's kind of like the Medicare update for 2016. So what's coming down the pike is what we'll do. We'll give you a little presentation about, okay, these are the changes that are happening, and if you need to make any moves yourself and adjusting your insurance to adequately work with it. So I just want to put that out there. Like Ed said, we do go out, we bring materials with us, and we will talk to you about, okay, this is what's coming for 2016. These are what your options are, and this is what you can do about it. And sometimes that may mean you don't do anything. You just may stay put. But anyway, we're out there, we're giving these presentations, and so we're happy to have you come. Just make sure you contact your local senior center to see if we're having that sort of presentation. And
if they're not having one, ask them to schedule one, because we're happy to go out. Finally, when we have these meetings, and we're going to do a show next month on the changes, and the insurance business in the senior field is very evolving. There could be new Medicare plans in the area, or new Medicare health plans that may have offerings that might save you some money. So we'll talk about that. We'll have all that information as well. So again, thank you for having us in your home. We'll see you next month. And hey, it's been a great year for us, and we hope you've enjoyed our program. Thank you very much.